Welcome to S-Info Podcast, a European format showcasing independent journalistic investigations developed in collaboration with local communities. A project designed to inform, delve deeper, and build new grassroots narratives.
In the heart of Piedmont's public hospitals, alongside wards where difficult and painful decisions are often made, there is a silent but determined presence. It is that of Anti-Abortion Association, which, thanks to agreements and regional funding, operate in the same place where voluntary termination of pregnancy is legally practiced. This model has been in place in Piedmont for years, has gained broad political and institutional support, and continues to exist despite contrary rulings by the judiciary. But what does it really mean to have those who guarantee a right and those who work to dissuade those who exercise coexisting within the same public structure? What is the main topic of your investigation? Why did you choose it?
I investigated how anti-abortion associations use public funds from the Piedmont region in Italy to expand within the local healthcare system, in particular within family counseling centers and the public hospitals. And the investigation also recounts the case of the Stanza dell'Ascolto, the so-called listening room, a facility run by anti-abortion volunteers within Sant'Anna hospital, which is the leading hospital in Italy in terms of the number of births and abortions. What my investigation highlights is the direct funding that pro-life associations receive through a fund called Vita Nascente, Unborn Life, which was set by the region's conservative center-right government with the stated aim of providing financial assistance to women in difficult pregnancy situations. I chose this topic because it affects me closely. It concerns my city, the place where I grew up and live, Turin, and it concerns the use of public money and how it can influence healthcare, which is a public good, along with services that should protect gender health, which are underfunded in the Turin area.
How does this issue affect the territory you explored? What did you observe and document?
The case of the Fondo Vita Nascente and the listening room has sparked much debate, criticism and protest in the city. Feminist groups in particular have mobilized, but they are not alone. Citizens have taken to the streets to demand clarity on the use of funding and the protection of abortion rights. Through a request of access to documents addressed to the Piedmont region, I was able to obtain and view the documents containing the reports on the funds received by the associations, noting that these reports are often vague and lacking in information. This doesn't allow us to understand how the funds were used and raises further doubts about the use of public money. The anti-abortion associations obtain this money without specific checks and controls, but mainly through self-certification. This fund is worth more than 3 million euros. It was established in 2022, and each year the same associations have received increasing sums, even exceeding the requests they submitted. Furthermore, the training of volunteers who receive this money to help women is not verified, and there are no specific criteria for understanding the preparation and sustainability of anti-abortion volunteers who work alongside the pregnant women. What also emerges is that in addition to carrying out their activities within hospitals, claiming to help women in difficult pregnancy situations, anti-abortion associations in some cases also replace anti-violence centers. In fact, I have observed that in some cases, anti-abortion associations have received funds that they have used for helping women who are victims of gender-based violence. For example, they have paid for hotels where these women have taken refuge after leaving their homes and partners. But this approach doesn't help women, rather it risks to put them at further risk. And above all, these women were directed to anti-abortion associations by social services, which denied them the right to turn to anti-violence centers, which are the places designated to help women in Italy, women who are victims of gender-based violence, of course.
How did working with the partner association influence or enrich your work?
Collaboration with the network più di 194 voci that brings together formal and informal civil society organizations for civil rights and women's rights gave me a broader view of the phenomenon I was investigating and allowed me to dialogue with health experts and operators from anti-violence centers who enriched the collaboration. Also, this was important because in parallel with the investigation, the Regional Administrative Court in Piedmont had to rule on the appeal filed by the associations, Se non ora quando and the CGL trade union, which had requested the closure of the listening room inside the Sant'Anna hospital. When the investigation was published, this helped to keep public attention focused on the issue, given that the appeal dated back to October and the regional court had given its initial ruling in January. But the case was still open, and following the publication of the investigation, the court responded by ordering the closure of the listening room, as the agreement between the anti-abortion association that ran it and the hospital was considered illegitimate. As I also mentioned in the article, and as reported by the associations that appealed to the regional court, the court recognized that the pro-life movement, which was acting in the room, as an explicit reference in its statute to Law 194, which in Italy protects access to abortion, and is in clear contrast to this law, arguing that one of the movement's objectives is precisely to eliminate it. The Regional Administrative Court ruled that the agreement was unlawful, not only because of the lack of adequate supervision of the actual training of the voluntaries working in the room, but also because the court considered that the presence of an association that rejects Law 194 in a place where this law is implemented and protected is not compatible. So the collaboration with the associations that are at the forefront of gender health protection has allowed me for a comprehensive view of the fragilities and the problems of the listening room and about the Unborn Life Fund.
This podcast is part of S-Info, a European project funded by the EU, focused on media and driven by the need to strengthen democracy. The views expressed are those of the authors and do not necessarily reflect the position of the European Union. Discover all the investigation on sinfo-project.eu.